Dentures versus full arch implants. I have delivered both. I have watched both play out over years and decades. I'm going to tell you what I actually know. I am Dr. Tim Batita. I am a dentist, a medical physician, and an oral and facial surgeon. Being trained as both a dentist and a physician, a significant part of my practice is treating thousands of full arch implant patients. After spending years doing revision surgeries on cases that previously went sideways from somewhere else, I have seen what both of these paths actually look like inside the body over time. I'm going to walk you through what each option actually does inside your body, where each one falls short, and why I land where I land on this. By the end of this, you'll know which path is right for your situation, and you will understand why the other one keeps getting recommended anyways. Point 1, the case for dentures. Dentures have been the standard answer to tooth loss for centuries, and there's a reason for that. They solve the most immediate problem. You lose your teeth, you get dentures, and you can eat and speak and show up in the world without a completely empty mouth. For a long time, that was the best available answer. And for patients who cannot pursue surgery for medical reasons, it remains a legitimate solution. The appeal is real. The cost is dramatically lower up front. There is no surgery, there is no recovery, no implants, no waiting. Dentures spread as the default answer partly because they were, for a long time, the only answer. Full arch implants at the level of precision and predictability that exist today simply were not available for most of dental history. Dentures were what was possible, and once something becomes the standard, it stays the standard long after better options exist. Most dentists still lead with dentures for one simple reason. They can deliver them without referring the patient out to a specialist. The conversation starts and ends in the same office. Here's where it starts to break down. A denture sits on top of the gums. It does not connect to anything beneath the surface, and that matters enormously because your jawbone is alive. It needs a signal to maintain itself. When natural teeth are present, the roots send pressure signals down to the bone every time you bite and chew, and the bone responds by staying dense and full. When the teeth are gone and a denture replaces them, that signal stops. The bone no longer gets that signal it needs to maintain itself. And over time, in a process called resorption, it shrinks. A denture replaces what you can see. It does nothing for what is happening underneath. None of this means dentures are a failure. They solve a real problem and they solve it immediately. For patients where surgery is not an option, for patients who are generally not candidates, the denture is still a path forward and there is nothing wrong with that path. The issue is what happens to the patients who were a candidate for implants but chose dentures instead and were not told what the choice would cost them over the next 10, 15, 20 years. So let's look at the other side honestly, because implants have their own story and it is not as clean as the marketing makes it sound. Point 2, the case for full arch implants. Why is it called full arch dental implants? Where does arch come from? Is that different than full mouth dental implants? The answer is straightforward to dental practitioners, but to everyone else, they are speaking a different language. Full mouth dental implants means all the teeth get replaced by dental implants. A full mouth means top and bottom teeth, but not everybody needs a full mouth reconstruction with dental implants. Some only need top teeth done with dental implants, and some only need the bottom teeth done with dental implants. But why the term arch? When you look at a person smiling, it doesn't look like an arch. Let me show you using a model. When a person is smiling, this is what you see straight on. But when you look inside from underneath, a view that only a dental clinician typically sees, all of the teeth together suddenly look like an arch. This is one bridge replacing all the teeth in this arch, so it is called full arch. So to distinguish between full mouth dental implants, meaning top and bottom, and a single arch, they started calling it full arch. You can have a lower full arch, or an upper full arch, or a double arch, also known as full mouth dental implants. Full arch implants have become the aspirational option. The before and afters are dramatic. The marketing is compelling. When it works well, a full arch implant case is genuinely remarkable. A patient who has spent years with failing teeth or an ill-fitting denture walks out of a single procedure with a stable, fixed, functional set of teeth. The transformation on the same day is real. Full arch implants have grown enormously in popularity for legitimate reasons. The technology has improved significantly. The surgical planning tools, the 3D imaging, the ability to design a new smile digitally before surgery even begins, these things have made the procedure way more predictable. But here's what the marketing does not tell you. Not every full arch implant case is done the same way. There is a wide variation in how different surgical practices approach the procedure. And some of those approaches have a cost the patient does not find out about until later. One of the most common shortcuts I see is removing bone to make the procedure easier. A thicker dental bridge needs clearance. Instead of designing the prosthetic to fit the patient's actual anatomy, some practices take out healthy bone to create the space they need. It is faster, it is technically simpler, and the patient does not find out it happened because they do not know what questions to ask. When bone is removed to make room for the prosthetic, the surgeon has solved today's problem by permanently limiting your options for every problem that might come after. Bone does not grow back, so if the surgeon takes too much, it's gone forever. This is not an argument against implants. It is an argument for understanding how they are done before you choose who does them. The procedure itself is sound. The variation in approach is where patients get into trouble. A full arch dental implant case done with bone preservation in mind is a fundamentally different long-term outcome than one done without it. Both cases look identical to the patient on the day of surgery. So now you have the honest picture of both sides. What actually determines which one is right for you is not the marketing and it's not the price. It is something more specific than that. If you're finding this useful and you want more of this kind of straight talk about implants, TMJ, and everything the dental world tends to gloss over, hit subscribe as you keep watching. I put out videos specifically for people who are trying to make real decisions about their oral health and want an actual surgeon's perspective, not a sales pitch. Subscribe and let's keep going. Point 3, the real variable most people ignore. You have now heard the honest version of both sides. You know dentures come with a bone loss problem that does not show up until years later. You know implants can be done well or done in a way that borrows against your future. You are sitting here with both of those things in mind, and you still need to figure out which path applies to you. Here is the diagnostic I actually use. Ask yourself these questions. Are you medically stable enough to undergo a surgical procedure with sedation? This is not about age. I have treated patients well into their 90s. It is about whether your overall health can support a planned outpatient surgery. Do you have enough bone remaining to place implants, or can a specialist find stable natural bone? This is where a CT scan and an experienced oral surgeon matter the most. Do not let anyone tell you that you are not a candidate without speaking to an oral surgeon with a CT scan. Are you still on the dental hamster wheel, meaning every visit finds something new to fix and you are spending money maintaining teeth that are not serving you? If the answer is yes, the calculation on cost changes completely. How long are you planning to live with this decision? A denture at 55 is a different conversation than a denture at 95. Are you currently avoiding foods, avoiding social situations, or hiding your smile? If your teeth are affecting how you live, the cost of not fixing it has to go into the equation. If you are medically stable, if there is bone to work with, and if you are living with failing teeth or an uncomfortable denture, and you have years of life ahead of you, the math on implants changes significantly. The upfront cost is real. But what most patients who choose dentures do not factor in is the ongoing cost, the relines, the adjustments, the replacements, and eventually the bone loss that limits their options later. The patient who chooses implants and goes to the right surgeon pays once for a permanent solution. The patient who chooses dentures often ends up paying repeatedly for a solution that is slowly getting worse. Which brings me to where I land. And this one I am going to be direct about, because after everything I have seen, I think dancing around it doesn't help you. Point 4, here's the verdict. For patients who are healthy enough to proceed, who have enough bone to work with, and who are going to be living with this mouth for the next 10, 20, or 30 years, full arch implants are not the premium option. They are the medically correct option. The denture is cheaper today and more expensive for the rest of your life. The implant is more expensive today and protects everything that follows. I have watched this play out in thousands of patients across my practice. The patients who chose implants and had them done with bone preservation in mind come back years later with stable, functioning, comfortable teeth. The patients who chose dentures come back with loose dentures in a bag, less bone to work with, and in many cases, limited options for converting to implants because the bone that would have supported them is no longer there. I get referred revision cases regularly. I see what happens when the first decision was made without the right information. What changes when you choose the right path is not just comfort. It is nutrition. It is muscle mass. It is the ability to eat a real meal, to stay strong, to remain active. These are not cosmetic concerns. They are connected to how long you will live and what that life looks like. The quality of life before with teeth to after dentures significantly drops. The function and chewing capacity goes way down. The nutritional value you lose from choosing foods you can actually chew is dramatic. This causes so many systemic issues, specifically in the later decades of life, when a steady source of healthy nutrition becomes more important than ever. When I was a young boy, my own grandmother was told that at the age of 90, that she was too old for implants, which is a complete myth, by the way. They assumed she would not live too much longer. She lived another decade. She was given a denture, and she hated it because she could not wear it. She stopped eating real food. She lost muscle mass. She stopped moving around. She spent her last 10 years with a poor quality of life in a chair because nobody gave her the real option. I became a surgeon partly because of her, and I'm not going to give my patients that version of the story if I can help it. So now you know where I land. What I want to leave you with is what to actually do with that information. So point 5, how to act on this. Tonight, before you make any decision about your teeth, do one thing. Write down 3 questions and bring them to your next consultation regardless of who you see. First, can I get a CT scan at this visit so we can see exactly how much bone I have? Second, if you are recommending implants, will this procedure preserve my bone or will bone need to be removed? Third, if I start with a denture, what does my situation look like in 10 years if I later want to convert to implants? Those 3 questions will tell you more about whether you are in the right place than anything else you can do. A surgeon who gives you straight answers to all 3 is a surgeon worth trusting. A surgeon who gets vague on any of them is a signal to keep looking. You came into this video with 2 options and a decision you have been putting off. You have heard the honest version of both sides from someone who has watched both play out in thousands of real patients. You do not need another comparison article. You need a CT scan and a specialist. You need someone who will tell you plainly what is actually possible for your specific situation. That is what this decision actually requires. I'm Dr. Tim Batida. If this gives you a clearer picture of where you stand, there is a lot more on this channel worth watching before you make any decision. I have a video that walks through exactly what happens inside your body when you lose teeth and do nothing about it. It will change how you think about this. Links are on the screen now. Stay healthy, share your smile with others, and I'll see you in the next video.